Did you know that the brain is responsible for decoding all pain for the entire body? The brain receives about 11 million bits of sensory data per second to decode. Pain decoding can take an average of half a second before you consciously recognize what the brain has decoded. The brain itself has no pain receptors. However, protective brain layers like the meninges do contain pain receptors. When altered by swelling, inflammation, and some infections or pressure from bleeding, these layers can transmit pain signals to the brain for decoding.
Welcome to Taylor Brain Bytes with Arlene R. Taylor, PhD, Brain Function Specialist.
When cerebral edema or brain swelling occurs, it can increase intracranial pressure, ICP. This can result from any traumatic brain injury or TBA. Even wearing a helmet cannot prevent serious blows to the brain from slamming delicate brain tissue against the hard skull. This can cause bleeding and swelling, as can strokes and concussions. Swelling can cause pressure as brain tissue expands against the hard skull, resulting in headaches, nausea, vomiting, problems with vision, and sometimes even altered consciousness. These symptoms arise because the swelling also impacts the meninges and other brain structures that can sense pain. The pain experienced during these conditions is not from the brain itself, but from the surrounding tissues that are sensitive to pressure changes. Inflammation in the meninges, the coverings, and other surrounding tissues and brain infections can also result in additional swelling. According to Dr. Herbert Benson, and I quote, "Stress does not cause pain, but it can exacerbate existing pain. Much of pain is what he calls remembered pain. It is the constant firing of brain cells, leading to the memory of a pain that lasts even though the bodily symptoms causing the pain are no longer there. The pain is residing because of the neurological connections in the brain itself." End quote. Studies at McGill University reported that males tend to recall physically painful experiences and become stressed by them. Females appear not to recall the painful experience. Increasing evidence suggests that chronic pain is a problem to the extent that you remember it.
Thank you for watching Taylor Brain Bytes. Check out allmylinks.com/brainfunctionguru, and please subscribe to Dr. Taylor's YouTube channel, youtube.com/user/braingurutaylor.